Um, I just wanted to give you kind of an update on where I am from my first surgery and to let you know how things are going with my second, because there was a drastic difference between the first and second, and also because I had um, a lot of difficulties that I had to overcome from that first one that a lot of people had questions about and still do. And with it being a year past that first one, I thought it'd be a good time to give an update on that progress. So I just want to start out by saying that um, thank you for the people who have kept an interest in where I've come from day one with that surgery, because it has been a difficult road, and just the messages that I've received have been really, really encouraging. But let me just get into just a brief history. If you haven't seen any of my videos, you can go back and look at that. But just a brief history is that I was brushing my teeth one morning and my jaw locked open. I had a lot of pain, so I went and saw a specialist. I had a couple of opinions before having several procedures done. I didn't jump into joint replacement surgery. That was kind of the first question I had, um, because it is major surgery. So after having the surgery done, I was one of very small percentage of people who have kind of those terrible, not side effects, but for lack of better words, side effects. I had paralysis, and as you can see now, even from the surgery, I have paralysis. Now that isn't uncommon, but with the first one, you can go back and see those videos. But with the first one, I had paralysis not only to my mouth, like you can see with this one, but I also had paralysis to my muscles around the eye. In fact, it was so severe that I had to have a gold weight inserted into my eyelid, and you can see a little bit of a scar there because the weight is actually still in the eyelid. I had Bell's palsy, where the eye could not close at all. Couldn't shower, couldn't sleep without having to tape my eye closed. So after having the joint replacement surgery, I had um, the side effect of the Bell's palsy, in which case I had to have the surgery to keep the eye closed with the weight, and that was successful. Um, the paralysis of my mouth did go away, and the only thing that kind of lingered from that surgery was a numbness that lasted even up until the second surgery. It was from about here to here, but that numbness turned into pain, and it was pain that was almost like a shock pain. Um, I would say that it's almost like a pins and needles feeling, but it was triggered from heat or cold. Even when I would put my shirt on and I would slip my shirt over my face and I would feel it against my lip and my chin, and it would hurt. And like I said, that lasted up until this surgery. And that, um, the doctor said, was most likely from not necessarily the joint replacement surgery, but because at the same time I had that surgery, I also had a sagittal split to the lower jaw to push my jaw forward because I had an overbite also. So they explained that the nerve that runs along here kind of got bumped around and bruised a little bit, and that may have caused some of the paralysis on the lower jaw in conjunction with just the joint replacement itself, because it all kind of runs together. So, again, I'm kind of that small percentage where I kind of got everything thrown at me at once. But the paralysis did go away, and then the weight did help with the weakened eye muscles. But as I said, the numbness and pain did stay. About 7 or 8 months ago, I continued to have kind of clicking, and pain started to come back within my jaw. And not only was it on the left side still, which I found concerning because I essentially had a brand new jaw, or of course joint, but also I was having pain on the right side. And when I went into having the joint replacement surgery, I asked the surgeon, do I need to have both joints replaced? I thought it was a legitimate question. Do I need to have both joints replaced at the same time? Considering with having one done, would there be any wear and tear happening to the other? Would there be compensation to the natural joint for having the artificial joint put in, if that makes sense? But I was told it was a healthy joint, everything would be fine. Well, unfortunately, as the pain intensified and I started to realize that I couldn't eat normal foods, we did more scans and x-rays, and it turned out, obviously, that the joint was not in a good place, and we had to do joint replacement on the right. And I asked with frustration, when we scheduled to have the left done, I asked, do we need to do both? And I was told no. I was of a small percentage where it just got to be at the point where the right joint was in bad shape. That's not the best consolation, just that I'm of a small percentage. Again, it's just frustrating. But in any case, I needed to have the joint replaced. And actually, when the surgeon was doing the surgery, he told me afterwards, I should say, that basically, if you are looking at, this is the best way to do it, if you're looking at your joint sits in like this, and it rocks back and forth, that is the function of the joint. Mine was slid over and trying to function like this. It had also caused a dent, a very deep divot in the joint because of where it was sitting. And he said, well, no wonder you were in so much pain. So, to answer some of the questions that I've been getting, I had lost a lot of weight due to the fact that I couldn't eat, and I was in a lot of pain. And that was the reason. It's hard to really see what's going on, even from scans, until they're in there, is what was explained to me. And he said that he had never seen anything like that before. So again, I'm a small percentage. He said that I've been kind of an anomaly this whole time. So that's kind of the explanation of what my case is like. So with all the pain and all of the issues that I've been dealing with, a twisted, positive thing out of this is that the pain that I had been feeling in this area since my original replacement has now just simply turned into numbness. So I can touch this area, I can heat the cold, my shirt touching my face. all of that has now just turned to numbness, so it doesn't hurt. Um, I would normally have to adjust the way that I sleep so that it doesn't touch the pillow even. It had been an ongoing struggle, but now it's just numb. So I'm finding some positive in that. But as you can see, I have issues with the paralysis in this part. So I can't move it. It's the way I smile. I can't pucker my lips. Um, my eyebrow also. Um, Now, when I explained the Bell's palsy with the last surgery where they had to insert the weight into my lid, I could not close my eye. When I would try to, and you can see in previous videos, mainly the inner corner could not shut all the way down. If I would try and force my eyes closed, it wouldn't work. I've noticed with this one, like when I close my eye, I don't know if you can tell, when I try to force them closed all the way, the left is much stronger, the right doesn't close as tightly. I'm hoping that the muscle strengthens and it begins to close as tight as the other, because I don't want to have to go through that surgery again, but I'll keep you posted on that. My my post my post-operative appointment is in about 5 or 6 days. So at that appointment, I'll know more of where we'll go from here as far as therapy and what to expect, at least what the doctor expects, with the paralysis and things like that. What I have been doing is I started with some stretching. With the last surgery, they wanted me to start immediately. With this one, because of the state of the joint, I haven't been able to start immediately. They wanted me to start out slightly slower. However, the opening was much wider immediately than with the last time, which is a very good thing, because therapy last time was a big struggle. It was very, very painful. This time, I've been able to open 25 millimeters, which is a great accomplishment. Last time it was much smaller. To get to 14 millimeters was excruciating, and it took quite a while. And I think I go into that a little bit in my previous videos if you want to check that out. So I'm able to use my Therabite. In the last videos I was not able to, and that was mainly due to the sagittal split on the bottom. They've put in a titanium plate here, so I can only open to a certain amount anyway, mainly moving my jaw forward and backward. So with the Therabite, it almost acts like a jack, where it opens the mouth and you can move it further and further open. So in the hospital, they adjusted it to a certain point, which was set at 25 millimeters, because that's as far as I could open at the time. And we can adjust that further along into my therapy. And you basically insert it, and you open it as far as you possibly can. You hold it, and I'm supposed to do that as many times as possible. I did attempt to do that on my third, maybe fourth day after surgery, and